All right, welcome everybody. We are here today to learn a little bit about what chiropractic treatment involves so you can kind of take a look to see if it's something that might help what you might be suffering from. And if that's the case, maybe you want to go see Keith Cook, whose office is located up, 1704, I believe, North Riverfront Drive. Is that right, Keith?
That's right. It's the old Custom Home Improvers building for those that have been around for a while.
All right. And just as a reminder, Keith, you were a little soft on that one. So when you do begin, if you can lean in toward the computer a little bit, that would be great. Uh, Keith and I, in all honesty, have known each other for several years. We've been in some play productions together, and his lovely assistant, Amy, his wife, who is helping Keith on the technical part of things today, is
Hi,
also
everybody.
a wonderful performer. If you've seen the Amy Monet groups performing around town, she is Amy Monet. So I will step aside and let Amy and Keith take over. Thank you all again for being here. And if you want to review it after it's been done, you can find it at vinevolunteers.com. So take it away, Keith and Amy.
Thank you very much, Mike. You know, this is my first time having done a production like this, and I was kind of wondering what it was going to be like Zoom versus in person. And I don't know, it's maybe a little unnerving seeing people staring at you on a screen like this, but first of all, too, I got to give full credit to my wife. The PowerPoint that you're going to be seeing, she prepared for me. I've pretty much resisted things like this in the past, but she is a marketing person by nature, and Mike knows her and approached us through her. So I really didn't have much to say about that. So anyway, this is thanks to Amy that and Mike that this is going to happen today here. So the importance of chiropractic care. Now it says in seniors, well, that's a strong word. You know, I guess technically I'm a senior. I just turned 61. But a lot of these things that I'm going to be talking about today actually apply to all ages. And of course, we can all listen to it and receive it where it fits for us personally, of course. So things that we'll be talking about today, I'll tell about myself, and then want to get into what the spine a little bit in general, what chiropractic is, and of course, you've maybe heard of people getting their back cracked. Well, we refer to that as an adjustment. A crack is something not good. And then the benefits and importance of chiropractic for seniors or for anyone with need, of course, and questions. Now, Mike was asking if I had a preference for questions either during or not until after. And honestly, if you have a question right away, please feel free to just chime in, unmute yourself, and otherwise it's hard to remember your questions certainly too. So me, so this is big city living for me. I'm from a little tiny town in North Dakota, 1,000 people. Well, we counted 1,000. There was maybe some dogs and cats in there too, but so this is truly big city living for me. I've been in town now for 32 years and went to chiropractic school down in St. Louis, Missouri. And there's a chiropractic school right in Minneapolis. And so people have asked why St. Louis. And to be very honest, when I was an undergrad student up at Moorhead State, I went to a chiropractor. And that chiropractor, by chance, graduated from Logan College of Chiropractic down in St. Louis, Missouri. It seemed to work for him, and I decided I would give that a try. So anyway, that's how we ended up down in St. Louis. And we decided we wanted to come back and live in the upper Midwest. And Mankato turned out to be the town for us. So yeah, over 30 years, actually 32 years this November coming up already. So the spine, we all know what a spine is, but you know, there's the spine is broken down into 3 regions. There's 7 cervical vertebrae, 12 thoracic vertebrae, and in some literature, the older literature, you'll see the thoracic part of the spine referred to as the dorsal column. And then again, 5 lumbar vertebrae. So you'll see each vertebra is numbered according to its position in the spine. And so again, with a thoracic spine, it's T1, T2, etc. Or again, if it was the older literature, it would be D1, D2, etc. One thing of note too, if you look at this kind of side view of the spine here that's really important with the whole concept of chiropractic. You'll see what's the front of that spine, which is on the left side of this picture, called the vertebral body. And in between each of those vertebrae is a blue space, which represents where the disc is. We've all heard of the disc, but right behind each of those discs is an opening. That's called the intervertebral foramen, or it's an opening where then the spinal cord gives off a nerve root. And you'll see that at each level, there's one of those openings that the spinal nerve can get out. And it's important that there's room in that foramen so that that nerve can express itself, if you will. And when that room gets compromised, that's then where symptoms develop. And you'll see on this next chart here that each nerve has a specific job. And this is just a partial list, by the way. At the very top at C1, you'll see that it says the innervation, or it goes to the intracranial blood vessels, the eyes, base of the skull, the neck muscles. So that's where that nerve goes to. And if that nerve is indeed compromised for whatever reason, then the possible symptoms that you see in the next column include, of course, headaches and migraine headaches, visual problems. And so, you know, I practice mostly in a musculoskeletal manner, meaning that people will come to me with neck pain, back pain, etc. And every once in a while, I'll have a patient that maybe has heard from some other source or whatever that a chiropractor can help with asthma or can help with menstrual cramps or whatever. And, you know, let's talk about the asthma, for instance. T1 through T4, you can see those areas go to the lungs, and on the right side, the possible symptom, it's about 4 lines down, it talks about asthma. So for instance, I've had a patient come to me that said they had asthma and were on an inhaler. And lo and behold, finding that there was an issue with that particular person's second thoracic vertebra, we adjusted that, and he was able to throw his inhaler away. Now, I want to make it really clear to point out that I'm not suggesting at all that chiropractic can cure asthma, but what I'm telling you is that the nerve that's being interfered with can present with symptoms that are similar to asthma. So not actually the disease of asthma, but the symptoms. So a lot of times, you know, I'm really fun at a party. A person will say their stomach hurts, and I can reach around on their backside and then between the shoulder blades and ask, oh, I bet you this hurts here, doesn't it? And they'll say, well, yes, how did you know? It's because of this map. So it's really good general knowledge to have as a chiropractor. If a person talks about certain symptoms, I can go refer to that region of the spine and see if I can correlate that. So I didn't know this about chiropractic when I decided I wanted to be a chiropractor. I was excited about chiropractic just knowing I could help with neck pain and back pain, headaches. Seriously, and I was willing to spend my whole career doing that. And I still get goosebumps almost on a daily basis when it turns out that I can help a person with that. But when you look at the bigger scope and being able to help children with bedwetting or torticollis or Rhineck or ear infections, that's just icing on the cake as far as I'm concerned. It is pretty special. So that's something I wasn't aware of. And I'm going to guess that maybe most of you weren't aware of this aspect of chiropractic too. So what is chiropractic? And, you know, chiropractic, there's the modern day chiropractic treatment and stuff started with D.D. Palmer. He was in Davenport, Iowa. And it's been 125 years ago, roughly. I forget the year for sure. And he was observing the spine, and he was really into science. And he developed some premise, some hypotheses that needed to be tested. And so what he did was he had a janitor that was deaf. And he talked that janitor into letting him perform the very first ever modern day chiropractic adjustment. And lo and behold, the janitor received his hearing. So that was the first adjustment, and that spurred the whole science and art of chiropractic. And so, yeah, chiropractic does focus on the disorders of the musculoskeletal system and the nervous system and the effects then of these disorders on the general health. So a person can come into me with just a kink or a catch in their neck or their low back, and oftentimes we can do a treatment, an adjustment, one, maybe two, and they can have just radical improvement of their symptoms and their function. And that's really exciting. But if that condition has been like that for a while, it will develop into more of a disorder then. And the longer it's been there, the more established it becomes. And the more established then also the muscle memory becomes that way. And so that's the person that will need successive care. And how much care is again dependent on how established the muscle memory is too, or the number of times they've experienced those symptoms in the past too. So D.D. Palmer was the founder and father of chiropractic, and it was his son, B.J. Palmer, that was a younger guy peering around the corner watching his dad perform this adjustment on the servant. And he became then the developer of chiropractic. So, they talk about aging may be scary due to diseases, and that goes way back to when I was a kid. I had 3 goals in mind. I wanted to, well, probably more than 3 goals, but I wanted to be able to live to retirement. My dad didn't get to. My first wife didn't get to. And so it's not a given. I wanted to be able to live to retirement, but I also wanted to afford to be able to retire. And I also wanted to be able to enjoy retirement, have my health to be able to enjoy retirement. So I think a lot of this first sentence here where it talks about aging may be scary due to diseases, we see people that are afflicted and have troubles. And so many people that I see that come into my office have just come to accept in their mind that this is their lot in life, that they're then now going to have to live with and put up with. And maybe they come to me because they just want to satisfy their spouse that says, just go there and try it or whatever, or their friend, or somehow for some reason they came into the office. That's the one, that's the patient that is so exciting when you can give them a new lease on life and they can enjoy golf or visiting with friends or traveling again. I love that. In fact, just describing this is giving me my goosebumps again. I just love that. So it does affect one's health. And so chiropractic, we try to combat the effects of aging through chiropractic or through a healthcare procedure that is safe. And I want to stress and emphasize safety because chiropractors, it's certainly possible to hurt a patient, but man, it's just so infrequent, so rare that we hardly have to pay anything for our malpractice insurance. And that tells you something. We hear things in the media sometimes, and I'll address that right now too. Oh, I don't want to have my neck adjusted because I don't want to have a stroke. And I bet you every one of you, if you're honest, will agree that you've heard that potentially. And is that a possibility? Absolutely, it's a possibility. Those instances, when they have happened, more often than not, when you do the research behind that, we've found that it wasn't actually a chiropractor performing the adjustment, but it was somebody else not trained as a chiropractor trying to perform a chiropractic adjustment. And so you certainly want to have a trained professional do a neck adjustment if indeed you're going to have that done. And of course, it's medicine free and uses natural methods. I had a quote that Amy's gone now. My wife is gone now. And she said the little notes would appear on the bottom of the screen. Yeah, they're not there. So I'm going to try to paraphrase this quote as best as I can. It's attributed to Thomas Edison. And he had said that the doctor of the future will give no medicine and instead interest that patient in diet and nutrition and the effects of health to improve the immune system. And so it's honestly very similar to the premise and the theory, if you will, philosophy of chiropractic. So chiropractic is indeed very effective in minimizing or eliminating pain. Research has shown that it's as effective as most drug therapies for low back pain. Now, my presentation doesn't have any of these studies listed on here. And I apologize for that if you're a person that does want that sort of information, but it is in the refereed journals, peer-reviewed journals. And of course, it does increase flexibility and help then to restore health. So I've made a comment about what is an adjustment. And again, it's what lay people would refer to possibly as cracking. So when we're doing an adjustment, we're trying to affect a joint complex, which is involved in what we call a subluxation. And so the theory of what a subluxation is has changed. Like I said, I've been in practice for about 32 years. So about 35 years ago, up until 35 years ago, they used to teach that a chiropractor was actually moving a bone that was out of alignment. In essence, taking a bone that's in left field and moving it into center field. Well, that wasn't supported when you look at an x-ray, a simple x-ray. Before the adjustment, the patient's in pain, and the x-ray shows a certain alignment of the spine, if you will. After the adjustment, the patient could feel better, and yet a post x-ray, the spine didn't look any different. So that didn't lend credence to the theory then that we were moving bones. So while I was a student at Logan College of Chiropractic, they said, well, we're obviously not moving bones, but rather we're taking a joint, two vertebrae together that are stuck, and freeing them up. And I just made a comment about two vertebrae, and that's what you're seeing here too, but it doesn't have to be just vertebrae. A chiropractor will treat any joint in the body, including the TMJ, your hand joints, your knee joints. We treat a lot of extremities, but again, these pictures on the slides here will talk mainly about the vertebrae. So they says, well, we're not actually moving a bone, but rather we're freeing up a joint that is stuck. And that theory then held for about 25 years until they realized then that there's different ways to do adjustments. The traditional one that you see depicted here on this slide is with your hands. Well, this instrument that I use in my office on probably about 90 to 95% of my patients isn't forceful like the manual adjustment is in this picture. And again, there's nothing wrong with this technique. I do that in my office too, so I'm not trying to take away from the traditional technique called diversified. Research has shown that these two techniques are equally as effective. So if you've ever had one of these instruments done, or if you could feel the amount of thrust that it's doing on your finger, you would realize that there's no way that that instrument can actually free up a joint. There's not that much force there. So then they had to change the theory once again. And that theory that was changed then is still currently being used. And so what they're suggesting now is that each joint has a muscle or a group of muscles that cross over that joint. And sometimes those muscles will become splinted. And usually it's in your body's attempt or effort to be able to protect that injured joint or the corresponding nerve root that's coming out. If you see the nerve exiting the spine on either one of those pictures, I guess it says it on the left one under normal, it wants to protect that nerve. In fact, it will resort to great lengths to protect that nerve. If indeed just the splinting doesn't do it and the swollen joint capsule doesn't do it, I bet you've seen people that are crooked. They're bent way over to the side or their hips are off to the side. That's called antalgia, or that person is said to be antalgic. And that's done in your body's attempt to get you off of, or get that pressure off of that nerve root. So if that nerve root that we're seeing is being irritated there, and if that's the one that goes to your hip flexors, for instance, your hip flexor on that side, because you'll see there's one on both the left side and the right side of the body. So that corresponding hip flexor, for instance, will be weak because the nerve can't get to it. So the nerve and the end organ are kind of like, actually, they're not kind of like, they're exactly like, if you have a light bulb and you have a light switch, there's a wire connecting those two. And up here, I can see my light bulb. There's nothing wrong with that light bulb. However, if I were to crimp that wire real tightly, it potentially could cause that light bulb to dim. So there's nothing wrong with the light bulb itself, but the wire isn't allowing all the electrical energy to get to the light bulb. So the hip flexor, in the instance, in this example I was talking about, very often there's nothing wrong with that hip flexor, but the nerve that goes to that hip flexor is being interfered with or has pressure put on it. And it's really exciting when I have a brand new patient in the office, and if by chance they have a weak hip flexor, because honestly, a lot of people do come into my office with low back issues that does lead to one hip flexor being weak versus the other. And if indeed I can demonstrate that that hip flexor is weak, very often after we've performed that adjustment, by golly, that hip flexor is now strong again. Whether it's 100% stronger or if it's just moderately stronger or whatever. So it's really neat to be able to demonstrate that to the patient. So the term subluxation is meaning a joint that's not moving like it's supposed to, and there's the corresponding swelling that happens, and the pressure being put on that nerve root is what then they refer to as a subluxation. You'll still hear people say, in fact, I catch myself saying that, oh, this vertebra is way out of place here. Again, that goes back to 30 plus years ago when we used to say the bones were out of place. That could happen, but you wouldn't be at a chiropractor then. You'd be at a surgeon's office or someone with a scalpel or at least a needle that would have to do that procedure then. So that's the word subluxation that's associated or coined with chiropractic. So the manual adjustments, as chiropractors, we're trained to find or feel or palpate the spine to determine where it needs to be adjusted. So it's kind of like me telling the body what I think it needs. And we're trained to do that, but so that's how that process works. And then when I were to find that spot that needs to be adjusted, I would then set up in a manner of different ways to then release that particular joint. With this technique, for instance, Activator, in fact, Activator was invented by a chiropractor in Redwood Falls, Minnesota. It is now literally used all over the world. It is the most widely researched chiropractic technique that's out there in the world. And so because of that research, it not only has validated the efficacy of this tool, this technique, but actually all of chiropractic. So with this technique though, it's not me that tells the body what I think it needs through palpation, but rather we ask the body to tell me what it needs. Now, obviously the body doesn't actually talk, but there's a series of isolation tests or stress tests that we'll have the patient perform. And each of those movements will require a specific nerve to fire. And we know exactly which vertebral level or intervertebral foramen, that opening, that nerve exits. If there's nothing wrong with that segment, I won't see a change in the body's overall leg lengths because I'm going to be monitoring those leg lengths. If indeed there is something going on at that particular level, and even if it's a spot that the patient isn't outwardly aware of, the body is, and it is worried it's going to get hurt because we're challenging that dysfunctional segment, if you will. So it will automatically fire off a reflex, compensation will occur, and it will literally cause one leg to pull up short relative to the other one. Now, again, I know which segment I just isolated, so that would tell me then which segment to use this instrument on. And if indeed with that click, it bounces it out, then I know I got it. Or if it makes it better, but not all the way, that would tell me that that joint is likely not only stuck, but twisted and or tipping down. So we'll check for and clear those components as well. So that's how this technique works. And again, like I said, I don't have anything against manual adjusting. In fact, I do it in my office too. But you're probably all aware of people that are afraid to be adjusted, or it hurts to get adjusted, and so they'd rather not. Well, when they find out that there is a chiropractor that can do it with a different method, then they're the ones that have kind of made their way to my office. So back in the day, I did many more manual adjustments than activator adjustments. And then through the years, because of referrals, I do many more activator adjustments than manual adjustments. But truly, it's all about whatever helps the patient the most for their particular needs. So the benefits and importance of chiropractic care for seniors. I don't like the word seniors in here because this holds true for everybody, but I am going to talk about seniors with this right now here. One of the major problems that happen with people as we age is that we trip and we fall and we break a hip. And it's not just the pain and inconvenience of breaking a hip and the rehab necessary after that, but you wouldn't believe the percentage of people that do break a hip that end up dying because of the blood clots that form, and the blood clot breaks loose and it creates a stroke or an embolism that happens. So it's having the ability to not trip is truly very important. The muscle group that is most responsible for people tripping, and it gets weaker and weaker as we age, is our quadriceps. And so if our quadriceps can't bring our leg up when we're walking, then we start then acquiring that shuffling gait. And then things that we normally would have just normally stepped over with our walk now become obstacles, and we trip and fall. So one thing that we recommend for seniors and for anybody, and there's no pictures that demonstrate this, so I'll try to describe it just a little bit, but are squats. And they recommend doing throughout the course of a day the same number of squats as the number of years old you are. And you can do these squats in an assisted manner where your back is up against a wall and you just go down on the wall, and you only go as deep with that squat as what you feel that you can comfortably. And then you come back up again. And if you do that on a daily basis, it helps keep the quadricep muscles strong so that you don't trip and fall. So one of the things that as a chiropractor we would do is put patients on treatment programs that include exercises and stretches that are particular for their needs. So, the next slides we'll talk about what they do and an adjustment does. And of course, an adjustment will decrease the frequency of neck pain, back pain, whatever, or the severity of that. Sometimes you can get rid of it and it stays away. You've actually fixed that particular condition. But in all honesty, if a patient presents and they've had it for years and years and years, or they've had many exacerbations or many episodes, if you will, there's going to be a degree of permanency associated with that. And so a lot of times with adults, I'll just tell them that we're going to get you as good as we possibly can and teach you what you can do on your own until the next time, because there will be a next time. As opposed to children, when parents bring in their children, and when I say children, the youngest patient that I've seen in my office was 3 days old. Whereas the oldest patient I've ever seen in my office was 103 years old. And so that instrument that I was talking about, that activator instrument, I've used on both ends of that extreme, and including also Minnesota Vikings players. So the big bulked up muscular patients can respond to that technique as well. So yes, we're trained to locate where those subluxations are, and then we know that the correlation of that subluxation to the abnormality, if you will, of the soft tissues that are in that region of the spine. And so by getting that joint, that spinal joint dysfunction or that subluxation corrected, it decreases the pain in the back, in the neck, the head, or the extremity. And like I said, it's for any of these things here. You know, I get, one of my pet peeves is that I'll have a patient say, so-and-so doesn't believe in chiropractic. Well, there's really nothing to believe in. We're beyond that. We have, way back in the day, thankfully, medical doctors challenged chiropractors. Instead of just having clinical evidence of saying, we can help neck pain, back pain, or whatever the case may be, they'd say, prove it. It's not true unless you can prove it in research. And so, of course, research is very expensive, it's timely, and it took a while, but thankfully we were challenged as a profession. And now I can probably say that there's nothing to believe in anymore. It's all factual with the research. We can help decrease the pain at the very least. Or you know what? Maybe the pain isn't coming from that spinal joint dysfunction or subluxation. And if that's the case, as a chiropractor, we need to recognize that too. And if that's, and then if that is the case, point that patient in the right direction. When I was brand new in practice, I was 29 years old, probably looked 16 years old. And I had everything state of the art, including an x-ray machine. And I had an elderly lady come in that well, she was older. I just remember that for sure. She had fallen and she had corresponding back pain. And really with her age and the concern of osteoporosis, it warranted doing x-rays. She told me she had just had x-rays taken like several months before that, but I still had to rule out fracture. So we took x-rays. She was my 100th patient that came through the door. So I'm looking at these x-rays, and there on the x-ray with this young chiropractor, I could see L1, first lumbar vertebra, L2, a space where L3 should be, L4 and L5. Automatically, immediately, I knew what I was looking at. And even though you cannot diagnose cancer by an x-ray, you can certainly be pretty sure of some of the findings that you had. And so I got to share with her what my suspicions were, and I called her medical doctor and referred her back. And so my point being, and it was cancer, by the way, and she died a year later, but my point being, if it's not chiropractic in nature, we have to know that too as chiropractors and refer them to the proper provider. Chiropractors are considered primary care providers. We are portal of entry into the healthcare system. So we have to recognize and be able to diagnose anything and everything, but we only treat what our specialty is. And that makes sense, right? So yes, we help people feel better. The first goal is to help them to feel better, of course. The second goal is, what can we do, or what can we train them to do to help them to stay feeling better? And that's more important. Of course, we want them to feel better, but longer lasting than that is have them stay feeling better. So with adjustments, if you have a joint that's fixated or stuck, it would make sense then, if we can free up that joint, that it is going to increase your range of motion. And here on this slide, you do see on the top, it says spine and, of course, the extremities. So, you know, we talk about as we age, and I saw it with my own parents, but their world becomes smaller and smaller and smaller. And one of the kisses of death, it seems like, is once you lose your driving privileges, you don't go out anymore. So it can become very depressing. A lot of anxiety, anxiousness about that too. And so by reestablishing that joint function again and making them more able to do tasks again, you can see how that would do to a person's psyche or their depressive state that they're in. So again, they just all of a sudden can start going out and being a part of life and living again. So it does have a very positive effect on the quality. It's all about the quality of life as we become more involved again. And of course, I'm a brand new grandparent for the first time. The bottom line there says, and involved with playing with grandchildren. So that's so huge. So along with when joints are not moving very well, maybe they're not stuck totally or locked up, but maybe they're to a lesser degree just stiff and there's some muscle spasms. And so, and again, as a chiropractor, we would of course do manipulation or the adjustment as indicated, but we could also do possible things such as trigger point therapy or muscle stimulation or Graston technique, which is a scraping thing. And so to help with that, or sometimes I will refer that patient out to a physical therapist or to a massage therapist for some of that. Balance and coordination. I was at a convention out in Vegas. Actually, it's been almost 2 years ago. No, it was a year ago. And the effects of an adjustment, they're starting to understand why it works more and more. They're getting better and better with brain imaging, and they can see where those neurons in the brain are firing. And in a coordinated movement, the firings should be very close together in the brain. As movement becomes more aberrant, those firings become more spread out. And the research was done using chiropractic, and also on another test subject, 2 different test subjects, it was used, they're using acupuncture. And in both those test groups, those aberrant signals became closer together again, meaning the brain was firing in a proper manner. Athletes, the high-level athletes, they're all dealing with chiropractors. They know that their performance is better. One of the Minnesota Vikings that I treated was a receiver, and I read about him in the paper before he came in to see me, but they were saying that he wasn't able to make his cuts, coming out of his cuts in a sharp manner, and so he was easier to defend. Well, he was one of them that had that weaker hip flexor, and by freeing that up, it allowed his performance to be better. So the proprioception of having the things fire in a more coordinated manner, along with the strength being returned, of course, allows that athlete to perform at his highest level. So athletes certainly utilize chiropractic, along with then, of course, massage therapy, acupuncture. They're very into all those things like that. So balance and coordination are improved by stimulating then the joint receptors. See, if a joint isn't moving, there's actually little joint receptors that monitor motion in every joint. And when the joint is moving, those receptors get fired and then go up to the brain to tell the brain, we're good. But if that joint becomes kind of stuck or not moving like it's supposed to, now that those joint receptors don't get fired and don't go up to the brain with the same information. So the brain thinks, oh, there's trouble there at that segment. So it starts taking care of that by bringing those bones closer together. If you've ever heard of a disc that thins, that's the body's way to protect. If you think about watching a person playing basketball and guarding or defending their player, that defender isn't standing straight up. He is more stable if he crouches down and has his knees bent. So in essence, that's what the body's trying to do by thinning those joints, those discs out. It's trying to make that joint more stable. In fact, it'll keep doing that until those bones actually touch. The body's attempt there is to fuse that joint. So spurs will start growing up from the bottom and spurs will start growing down from the top. They'll ultimately touch each other and become then fused. So if you can keep those little joint receptors firing, the brain doesn't kick into that protective gear and putting calcium around that joint, which is then arthritis. So when a person comes in with arthritis, what I'll tell them is that I can't take the arthritis away, but at the very least, I can slow that process down, or at the very best, we can stop that process along with you having much less discomfort and certainly more mobility. So, and that's just what I made reference to here. It decreases the rate of joint degeneration. Again, if we can keep that joint functional, then the brain realizes, oh, we don't have to have that degenerative process engaged anymore because it's moving better. And again, we show people working out, and that, again, that's really important. Again, my job is to get a patient feeling better, but then it's the patient's job to stay feeling better. And honestly, the patients that are really good about doing that, it makes a world of difference with how they not only feel physically, but emotionally as well. It's such a huge difference. You can just see this cloud lift off of a patient when they start being able to engage in life again and they don't hurt. And again, it's just really rewarding. It's just really, it's fun. So yes, we do aim at increasing the health and well-being of the patients. And again, I made reference to this earlier today, that some patients will experience instant relief from the pain. But again, those are going to be the patients where this is a new thing. It's a kink or a catch that just kind of came about and doesn't have a history of being chronically exacerbated through the years. But yeah, those are the fun ones. And the body's ability to heal, in the chiropractic community, they talk about innate intelligence. And I think they're using that in some other communities as well. But it's basically the philosophy that our body can naturally heal itself. But we have to provide those items to the body. A healthy spine, the body's immune system, then it also increases if your spine is healthy. And so the way we improve that nervous system function is going way back to that chart that I showed you of the spinal effects. If there's a vertebra that's subluxated, putting pressure on those nerve roots, then wherever that nerve is going to isn't going to perform as well. Whether it's a physical action like moving a limb, or whether it's the stomach or the lungs or the heart. Infertility can be one cause of that. I had an interesting story where I saw one of my female patients in the grocery store, and in too loud of a voice, she thanked me for helping her get pregnant. And I was concerned that people didn't know what she was talking about. But yeah, helping the nervous system to perform, that's major, major, major. And again, we talked about that. With it, we can minimize the risk of falling by prescribing proper exercises, specifically your quadriceps muscles. That's the main one. And again, too, if your SI joint or your sacroiliac joint, or as us seniors will oftentimes call it, my sacroiliac. So that if that doesn't glide, you can't tilt your pelvis, meaning you can't bring up your leg. So maybe your quadriceps is strong enough, but your joint isn't. So yeah, we want to check all those components there. Oh, and that's the end. So I've been talking a lot, and Mike won't agree to this, but honestly, I consider myself an introvert. So this is out of my comfort zone, but so I have been talking a lot. So I'm ready to answer any questions that anybody might have.
And if you do have a question, don't forget to unmute yourself in the lower left-hand corner of the screen.
I have a question. When you were talking about older or seniors that and inactivity in this, are you seeing issues with such as the people in assisted and independent living that are shut in for as long as they've been shut in? And a lot of them aren't supposed to even really be out of their apartments. And I've got friends and a 97-year-old aunt that are in that situation, and it concerns me that they're getting enough activity.
I know that those assisted living facilities will have OT, PT there, or they may even have equipment there. But in all reality, seeing my mother go through that through just, first of all, senior living, and then assisted living, and then a nursing home, it doesn't happen. Very rarely will that particular person take advantage of that. I have very few of those residents, if you will, that come into my office because they're dependent on basically, typically,
Somebody,
family or somebody else. And it's a hassle for them. It's hard for them. But do they have that need? Movement is so important. Movement is life.
Mhm.
So if they're not getting that movement, then again, their world becomes that recliner or their wheelchair, and it's so sad. So yes, I agree totally with what your question is.
All right. Well, we can see Betty. I wonder if we've got a little noise coming in too. Did you have something you wanted to ask, Betty?
I was wondering, do you have any luck with chronic pain where surgery's been done, injections been done in the lumbar region?
You know, sometimes yes. And of course, it would depend on what type of surgery, what type of chronic pain they're having. If there's been a fusion surgery, for instance, of course, I'm not going to try to do anything to undo that fusion. But oftentimes with a fusion surgery, the joints above and or below become locked up and become problematic themselves and become then symptomatic, leading to more discomfort. So in those patients, we'll look for those corresponding joints. And so sometimes, yes, I'd like to say oftentimes, but I don't have any statistics that I've kept. But I always feel that it's worth trying. And maybe it's not going to be just chiropractic. Maybe it's going to be chiropractic in conjunction with massage therapy and or acupuncture, stuff like that. So I just hate to have a person feel that that you can't try it. In my office, we talk about a 2-week window of opportunity. 2 weeks is plenty of time to see if indeed a patient is going to receive benefit of lessening of that chronic pain or not. And so it's certainly worth being evaluated and checked, I think.
Okay.
Because
Yeah, my husband had, surgery and numerous injections. The last ones were facet injections in the lumbar spine.
Yeah.
And they helped for a short time, but nothing long term.
And likely that would be the same with the chiropractic adjustment. And again, those are the patients that we know have some degree of permanency with their condition. So we try to minimize the discomfort as best as we possible for as long as we can. And those are the patients that likely would come in periodically for a tune-up. I call them tune-ups. And the frequency of tune-up varies tremendously according to the patient and their needs. A lot of patients are seen once a month. Some people come in once every 2 months. And honestly, quite honestly, some of those patients that you're describing come in weekly, once every week, because they find value in lessening the pain to the extent that they can tolerate living with it better.
Right.
Yeah.
Oh, damn. Might have to make an appointment for him.
I'm very happy to check anybody. And again, what I'm really big on is telling a patient that if I can't help, we'll know that too, and I'll tell you.
Okay. Okay.
Yeah.
Thank you. Thank
You're
you.
very welcome.
Hey, Sarah, did you want to say something? I noticed you're not muted.
I have problems with my sciatic nerve. I wanted you to give me advice on that.
So when the sciatic nerve gets involved, there's something that's pressing on it. It could be muscle, it could be joint, or it could be the disc. So the first thing would be to determine what's pressing on it. If it's a muscle, then we could possibly teach stretches and give advice for moist heat. If it's a joint, that's where we would then do this chiropractic adjustment along with recommendations for possibly ice over the affected area to get that inflammation swelling down, etc. Or if it's a disc, we would use a different technique that I didn't show on my slideshow called flexion distraction, which again is another technique that has a lot of research to back up its findings there. So sciatica, again, and then there would also likely be some home instruction, whether it be Mackenzie back extension exercises, or it might be lateral movements or whatever. So it's depending on what's pinching the sciatic nerve or irritating it that would then dictate the type of treatment. And then also too, I'm really big on some conditions are really stubborn. And so I'll use the expression that, you know, sometimes it just takes a village. I'll do the chiropractic part of it and then have a colleague work with acupuncture with that person. Or maybe I even have one senior that when she's not wintering down south, will come to me as her chiropractor. She goes to her massage therapist and she goes to her acupuncturist. And when she finally did all three of that for her, then that opened up all of the doors and she is now able to do anything and everything. But it took that village, if you will. So yeah, determining what is causing that sciatica would be first and foremost important.
And I'm going to put in a plug for Keith right now because at one point, probably about 10 years or so ago, I had gone through a period where I lost a lot of weight. And I woke up, or actually I was trying to get to bed one night and my leg was just in great pain. I couldn't get to sleep. As a matter of fact, I think at about 2 or 3 a.m., I dropped Keith an email and asked him what was going on. And he prescribed the wet heat. And sure enough, I got a heat pad, put it on one night, and boom, that was gone because the sciatic nerve had evidently shifted as I lost weight and was somehow pinched or something else. So thank you for that, Keith.
Absolutely. And now I want to caution, that doesn't mean that the moist heat would be good for anybody, but in Mike's instance, as he's describing it, obviously muscle was the major component, and specifically the piriformis muscle. And so in that case, then moist heat along with some easy, gentle stretching is most appropriate for that. But I'd forgotten that, Mike. Thanks for sharing that. You know, this didn't even hurt. I'm glad that I'm glad that I agreed to this. And when I say agreed, I mean I was told to do this by my wife. But oh, hi, honey. He's here.
I heard that.
Okay.
As a matter of fact, I believe when I contacted Amy, she said, well, I'll have to talk to Keith. And then she said, no, he's going to do it.
Well, are there any other questions possibly? No? Okay. Well, Mike, thank you for asking. And I'm glad I could do this. And thank you for your participation, everybody.
And Keith, I don't know if you had mentioned earlier that you had some studies that bore out some things. If people have questions about some of that, would I be able to get them from these people and then contact you directly?
Yeah, honestly, they're very readily available by Googling as such too. But I know that I could find them. I don't even keep them in my office as such per se, but I know they're readily available too.
Okay,
Absolutely.
Wonderful. Any last questions before we let Keith go? I will say that the Amy Monet is at the Trio is performing out at Indian Island on Saturday night.
We'll be at Indian Island from 5:30 to 8:30 if you enjoy jazz.
And wine.
And wine, yeah.
Well, I saw Betty light up on that one.
All right. Well, thank you, Keith. Thank you all for coming once again. It's great to have this kind of resource in the community and have them readily available to us through Zoom or in person very soon, we hope. So thank you. And please know that the schedule for October is going to be, it may be in your email box right now. We're probably sending out the October newsletter today. So look for that to find out what's happening as far as the educational programming and other resources here at Vine Faith in Action. So thank you once again. Have a great day, everybody.
You too. Thanks.